My name is Sanjay Gupta. I'm a cardiologist. Today's video is entitled, Is it anxiety or a heart problem? So one of the most common and frightening questions people ask me is this. How can I tell if my symptoms are anxiety or actually related to a heart problem? And I think this is a really important question because the symptoms of both can overlap, and the consequences of missing a true heart problem and attributing everything to anxiety can be serious. So let's try and break it down. Why does this confusion between anxiety and an underlying heart problem happen? Well, anxiety is not just in the mind. It is a full body experience. It is a full body response. It raises your heart rate, it increases your blood pressure, it makes you sweat, it can give you chest tightness, it can even give you heart palpitations or skipped beats. And that sounds a lot like heart disease, doesn't it? So that's why patients and even doctors sometimes struggle to separate the two. But there are some features that suggest anxiety. So anxiety-related symptoms often come in waves or attacks, especially at times of stress. Anxiety-related symptoms are often associated with trembling or tremulousness, sweating, a sense of dread or hyperventilation. Anxiety-related symptoms often happen at rest, not just with exercise or exertion. Anxiety-related symptoms tend to improve with distraction or calming techniques. And in panic attacks, chest pain and palpitations can feel very real, but the underlying heart itself is structurally normal. There are, however, certain red flags that make us think of a heart condition. So if these are happening, it's probably more likely, or at least worth excluding, a heart condition before attributing them to anxiety. So if you get chest discomfort, so not necessarily pain, although pain is also a symptom, chest pain or chest discomfort, chest heaviness, chest tightness, that reliably comes on with exertion and eases with rest. That is very much more suggestive of an underlying heart problem. Shortness of breath or fatigue which comes on activity. Palpitations that are sudden, sustained, and associated with dizziness or collapse. So you see, with anxiety, the heart will go fast, but the way it rises, the heart rate rises, it rises gradually. So your heart could be 80 and then 90, 110, 130, 150, 160. Whereas heart rhythm abnormalities, if there was a problem with the heart would go like a step. The rate would go like a step. So your heart would be 80, 90, and then next minute it's 180, 180, 180, 180, 180. And then when you come out of it, back to 90. With anxiety, it goes up slowly, 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 comes down slowly. With a heart rhythm problem, it goes up, bang, just like a light switch, from 90 straight to 180, will stay there and then come out. Okay, so palpitations are sudden, sustained, and may be associated with dizziness or collapse, and that's more likely to be the heart. A family history of early heart disease or sudden death, if there's a family history and you get these symptoms, that's important, particularly early heart disease or early sudden death. Say if someone says, oh, my grandfather died at the age of 80 with a heart attack, that wouldn't worry me. But if someone says, well, 3 of my family members have dropped down dead out of the blue in their 30s, that would worry me. And of course, with heart problems, you may get abnormal findings on examination or tests like an ECG or echocardiogram. So if you have any of those things, a bad family history of premature death, if you're getting these sudden onset palpitations, if you get chest discomfort or breathlessness or activity which gets better with rest, if you're known to have a bad heart, it's very important that the heart must be thoroughly checked out. There is, of course, a relationship between the two as well, and here's the key point. Anxiety and heart disease are not mutually exclusive. Anxiety can make heart symptoms feel worse, and living with unexplained palpitations or chest discomfort can cause anxiety. Sometimes the two fuel each other, creating a vicious cycle, and that is why they both need to be addressed, not just one. So, if you're experiencing symptoms, don't assume it's just anxiety. Always get checked with a history, examination, and if you need tests such as an ECG, echocardiogram, or a Holter monitor. Once serious heart problems are ruled out, then treating the anxiety becomes much easier, and symptoms can often improve dramatically. The real answer isn't anxiety or heart problem, it's about listening carefully, investigating properly, and often treating both. So if you've been worrying, is this my mind or my heart? Know this, you're not alone, and the distinction isn't always obvious. But with the right approach, we can find the cause, treat it, and most importantly, give you back your peace of mind.